Welcome to NCLEX RN exam practice test. Our topic today is safety and infection control. Use the link in the description to download the app on the App Store for free practice tests. Number 1. Bacteremia after intravenous insertion is an example of which type of infections? A. Opportunistic infections. B. Exogenous infections. C. Endogenous infections. D. Iatrogenic infections. The correct answer is D. Iatrogenic infections. Explanation. Iatrogenic infections are those that are caused by procedures, for example, urinary tract infection after Foley insertion or bacteremia after intravenous insertion. Number 2. A patient comes to the hospital for a test of hepatitis B virus. After completing a blood draw for the patient, the nurse is about to dispose of the needle. Which of the following is the correct way to dispose of the needle? A. Recap needles right after use. B. Break the needle immediately. C. Place the needle in the nearest puncture-resistant container. D. Place the needle into any biohazard disposal container. The correct answer is C. Place the needle in the nearest puncture-resistant container. Explanation. Regardless of a patient's blood-borne pathogen status, the same procedure should be followed when disposing of used needles. Immediately place used needles in the closest puncture-resistant container, which should be removed for disposal when about 3/4 full. Never recap needles as it can result in accidental punctures of the fingers or hand. Never place a needle into a biohazard container where it may injure or puncture someone else. Never point a needle toward any part of the body or break it prior to disposing of it. Number 3. Which of the following is not used to treat listeriasis? A. Cephalosporins. B. Penicillin. C. Ampicillin. D. Trimethoprim sulfamethoxazole. The correct answer is A. Cephalosporins. Explanation. Listeriasis, caused by Listeria monocytogenes, finds expression in encephalitis, meningitis, or meningoencephalitis, and septicemia. It is also a factor in intrauterine or cervical infections in pregnant women. Listeriasis is effectively treated with penicillin, ampicillin, or trimethoprim sulfamethoxazole. Listeria is not susceptible to cephalosporins of any generation. Therefore, cephalosporins should not be used to treat Listeria infections. Number 4. A 6-year-old kid is being evaluated for seizures. While checking his condition, the nurse notices that he is staring blankly into space for about 10 seconds and does not answer your questions. After 10 seconds, he appropriately responds and doesn't recall the event. This is known as what type of seizure? A. Tonic-clonic seizure. B. Partial seizure. C. Myoclonic seizure. D. Absence seizure. The correct answer is D. Absence seizure. Explanation. This is an absence seizure and is most common in children. Absence seizures involve brief, sudden lapses of consciousness. Someone having an absence seizure may look like he or she is staring blankly into space for a few seconds. Then, there is a quick return to a normal level of alertness. Number 5. A patient reports a cough with blood-streaked sputum for almost 2 months with night sweats and an unintended 20 pounds weight loss. The nurse suspects tuberculosis. What type of precautions would be appropriate? A. Contact precautions. B. Airborne precautions. C. Droplet precautions. D. Standard precautions. The correct answer is B. Airborne precautions. Explanation. Tuberculosis is a bacterial infection spread through inhaling tiny droplets from the coughs or sneezes of an infected person. Therefore, healthcare providers are required to follow the airborne precautions when treating the patient. Number 6. Fever, malaise, nausea, anorexia, abdominal discomfort, dark-colored urine and jaundice are most likely to indicate which diseases? A. Hepatitis A. B. Giardiasis. C. Anthrax. D. Shigellosis. The correct answer is A. Hepatitis A. Explanation. Hepatitis A is a systemic viral infection, short incubation type hepatitis, that involves the liver. Hepatitis A is extremely contagious and caused by an RNA enterovirus. It is transmitted via the fecal-oral route or paternally. Signs and symptoms include sudden onset of fever, malaise, nausea, anorexia, abdominal discomfort, jaundice, enlarged liver, hepatomegaly, dark urine, transient pale stools, upper right abdominal quadrant pain, and fatigue. Number 7. A nurse is working in a nursing home when there is a fire in the kitchen and cafeteria area. In this situation, what is the nurse's first course of action? A. Call 911. B. Extinguish the fire. C. Evacuate all patients from the facility. D. Remove all patients out of harm's way. The correct answer is D. Remove all patients out of harm's way. Explanation. Each facility will have its own emergency response plan, in which the nurse will have a specific role. RACE is an acronym that hospital personnel use to remember their duties in case of fire. 1. Rescue, remove all patients from the area of danger. 2. Activate alarm, pull fire alarm or call 911. 3. Confine the fire, close doors to the unit or place. 4. Evacuate or extinguish, National Fire Protection Association or Occupational Safety and Health Administration fire safety. Therefore, here, the nurse's first priority is to ensure that all patients are removed from immediate harm. Number 8. Which of the following is an example of reconstructive surgeries? A. Colostomy. B. Hernia repair. C. Scar revision. D. Appendectomy. The correct answer is C. Scar revision. Explanation. Scar revision is an example of reconstructive surgeries. Reconstructive surgeries are those that restore function or appearance of tissue. Number 9. Which of the following is the correct order when removing personal protective equipment? A. Mask, goggles, gloves, and gown. B. Gloves, gown, goggles, and mask. C. Gown, mask, goggles, and gloves. D. Goggles, gown, mask, and gloves. The correct answer is B. Gloves, gown, goggles, and mask. Explanation. The order for removing personal protective equipment is gloves, apron or gown, eye protection, and surgical mask. All personal protective equipment should be removed before leaving the area and disposed of as healthcare waste. Perform hand hygiene immediately on removal. Number 10. A 4-year-old patient is admitted to a medical unit for a suspected case of impetigo. What type of precautions should be implemented? A. Airborne precautions. B. Contact precautions. C. Droplet precautions. D. Standard precautions. The correct answer is B. Contact precautions. Explanation. Impetigo is an infectious skin condition that is spread via skin-to-hand contact or indirect contact of the skin and other surfaces. Therefore, healthcare providers are required to follow the contact precautions when treating the patient to limit the spread of this skin infection. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.